Hello and welcome to A Discussion With. I'm Brett Poirier, and today I'm sitting down with two guests. We are talking about the Metro West Adolescent Health Survey, and I'm sitting down with Susan Cowell and Russ Becker. Thank you guys so much for joining me.
Thank you so much for having us.
Thank you. We're happy to be here.
Absolutely. So, Susan, you're the Wellness Department Chair for, is it just the high school or for all of Medfield?
The district, yeah, K-12.
The whole district. And then, Russ, you are the School Adjustment Counselor. So this information obviously very much tied in with what you guys do. Can you guys tell me a little bit what you do in the schools and what your roles are?
So School Adjustment Counselor, honestly, it's a terribly named title. I don't know why the state came up with it. I'm a school social worker. And so this data directly impacts my work because I work one-on-one with students who oftentimes are struggling with some of the more mental health challenges that we know to be relatively prevalent within our town and our school district. So.
And I deal more in universal education for all students. So one of my responsibilities is to design and oversee the curricula for health and physical education for the district. So every one of these topics is a content area of our health curricula, in many grade levels. So this helps to direct our curricula decision making for the schools.
Let's talk a little bit about the survey itself. For those who may not know what the survey was or what it covered, what is the survey? What were some of the topics that they talked about?
So the survey covers about 13 areas, and the one area that's only on the high school survey is sexual behaviors, but all other areas are equally distributed on both the middle school and the high school survey. So students in grades 6 through 12 take the survey every 2 years, and things like bullying behaviors, cyberbullying, any other violence that was reported, substance use, mental health.
There's a handful of them.
Yeah, there's a whole bunch. Distracted driving,
Yeah, right.
Unintentional injuries, like are they wearing seatbelts, helmets?
Who puts on this survey? Is this something that the Medfield Public Schools decided we want this survey to come to our school, or who puts this on?
Right. No, actually many years ago, before the Metro West Health Foundation started this project, it was an awful lot of work for me to go and find people who could provide us with research-based questions, and we ran it ourselves. We ran it similar to the Youth Risk Behavior Survey, which is a federal program that the CDC runs. So they run a program throughout each state, so that's where our state data comes from. And then they take state data and they put it together, and that forms the United States data, the national data that you see in our survey. Then with the sale of the 2 hospitals in the Metro West area, that they started a foundation, and that funds this project. And the project is coordinated through Education Development Center, EDC, out of Waltham. So they run this for all 26 Metro West communities.
The survey itself, you presented it at one of the school committee meetings, which you can see.
Results.
Yeah, if you wanted to watch the presentation, it's actually on Medfield TV on our watch page. But so you presented the information. It's a massive survey. You guys got back, was it 600 pages of results?
It's
close to it.
A
Yeah,
lot
if
of
not.
many hundred. Yeah, I didn't count them, but we'll go with that.
yeah, it sounds impressive.
Yes, it does.
That's a lot of data to go through. Who goes through that data? Who actually sifts through that? Is that you guys that go through the data? Who's going through it?
Stephanie Wordley is our guidance department chair. She's our district K-12 department chair. And she and I took this on. It's been so helpful to have her join me, to have another person to bounce the ideas off of and not be looking at it in isolation. So she and I initially looked at it together and came up with a strategy that we did for the first time this year, engaging all of the administrators throughout the district. So it started with Stephanie and I, then we brought Russ in. Russ has a personal interest as well as a professional interest in this. We're both kind of survey data geeks a little bit and really find the value in student voice. So we appreciate that. And then we went from just the few of us looking at it to giving it the data results to all of the guidance counselors, 6 through 12, all of the wellness teachers, 6 through 12, the school resource officer, the principals and assistant principals in both buildings, the superintendent, and everybody submitted to me what their top 10 concerns, something like that. What, not even limiting it, just like what sticks out to you? What do you think we should be talking about? And so Stephanie and I took all that data and we put it together, and we created some charts to kind of have talking points, and we put those big posters up around the room, and we had everybody come together, all the superintendent, assistant superintendent, student services director, our curriculum director, all the principals from the school district, and we all walked around the room and looked at all the data and talked about, each of us kind of stood by the posters that really spoke to us about what's important to talk about. So it was really quite a collaborative effort to come up with what's going to go into this presentation that the school committee saw.
You have it in some of the slides, is that meeting, that presentation.
Right.
What were some of the things that were picked out that stood out to you guys, that these professionals are looking at this data? What were some of the things that stood out?
Sure. So for me, coming from a mental health background, this is like Christmas morning every time that I get my hands on the data, because I think it is so rich with information. And I think because we've been doing this for a number of years, I think this is
Since 2006.
Yes, so a great deal of years, we can really understand and see trends and kind of allow the data to tell a story about where our town has been, where it's going, and then some of the things that we feel like we need to do right now in order to continue making our kids healthy. So for me, what really stood out were a lot of the trends in mental health. So my position was actually created 5 years ago based off of some of the information from this survey. 5 years ago, we had a significant increase in some pretty negative mental health data. And so I think Susan, everyone who was looking at this kind of recognized like we need somebody on the front lines who can begin to address some of the mental health challenges that we know our students are facing. So now 5 years later, what's exciting, I do split my time between the high school and the middle school, but I'm probably mostly at the high school. We're beginning to see some of those trends go down for the first time in what I think is 10 years from what I can remember, and pretty significantly down as well. So for me, that was obviously a very positive piece of information that came out of this, but as I'm sure you can understand, you begin to attack one thing and you begin to understand the trends and figure out how to solve some of the problems, and then something else crops up. So unfortunately, we're seeing a lot of challenging mental health data now at younger ages. The middle school specifically has seen a pretty significant upturn in some difficult behaviors and some mental health challenges. And I think keyed with that are some other potentially dangerous behaviors that oftentimes go hand in hand with mental health and with the other things that we know make teenage years very hard for our kids. So
Yeah, so the area besides mental health that got a lot of attention was substance use. So Medfield has historically, based on the results of the survey, students have historically reported low drug use among what you would consider street drugs, right? But in terms of alcohol, there's been more alcohol use in Medfield than in all surrounding towns combined. That has been an ongoing problem for us and something that we've been addressing from day one. Binge drinking, high risk, is considered high-risk drinking, 4 or 5 drinks of alcohol within a short period of time. That is also something that we have a real problem with in this community. And so substance use and mental health issues oftentimes are seen together, hand in hand. Not that one causes the other, but we frequently see them co-occurring. So it's really concerning that these are our two biggest concerns. It's noted that Medfield's not alone in these being the two most concerning issues, but the fact that our drinking is higher than all the other areas around, all the schools around us, that's concerning.
This is obviously just data, and so one of the problems with data is it doesn't tell the story, and it doesn't explain why the data is the way it appears. And so is there anything that tells you why the data might be like that, why the drinking might be so high? Is there anything that actually indicates towards that?
One of the, I don't have the data right in my head, but how students access alcohol, the amount of access that kids have to alcohol is a big factor in how much use there is. So if parents provide alcohol, there's going to be more alcohol use. If parents don't provide alcohol, but alcohol is available in their home for students to access without permission, that's going to increase use. If parents don't give their kids the message that alcohol use is dangerous and that they shouldn't drink, that's going to increase use. So access to alcohol and parent permissiveness are probably two of the biggest reasons why some teenagers drink more than others.
In this school committee meeting, you said almost 50% of students claim to have gotten their alcohol from an adult. whether it was bought for them or from the house, it was almost 50% received it directly from an adult.
Well, 100% of kids get it from an adult ultimately.
It's true, yes.
Right? Because they bought it from someone, either they went in with a fake ID and bought it themselves from an adult who's working there, or an adult went in and bought it and they somehow either accessed it with permission or without permission. But one way or another, it's all coming from an adult to a child. On the survey, there's a question that asks students if they have been drinking in the last 30 days prior to the survey. So we call that current drinking. If you said that you're a current drinker, where did you access the alcohol the last time that you had it? And so we could see all the places that kids said they'd gotten, and 50% of those students said that they accessed it from home. Of that 50%, some of those kids accessed it from home with permission from their parents, and others without permission from their parents. But 50% of them did get it from their own home.
Wow.
Yeah, so that's important for parents to know and to really think about if they want their teenagers accessing alcohol, because, you know, drinking alcohol at an early age has just, you know, very high risk factor for other problems in life.
And I think that kind of speaks to the culture of the town in general. We're a work hard, play hard town. And I think we see that in the schools where our kids are doing unbelievable things, but they work their tails off. They really do, honestly, to the detriment of some of their mental health. But I think some of the behavior that then comes out of that is on the weekends, they are really going at it as well. And I think we've had conversations with parents, and the mindset has unfortunately become, well, I'd rather them drink here because they're probably going to drink anyway, and I can at least sort of watch it. I can at least know what they're drinking and know that they're safe, as opposed to not wanting your kids to drink whatsoever. And like you said, I think the name of the game not necessarily is prevention, but it's about waiting until you start consuming alcohol, because we know that there are such significant issues that come out of early drug and alcohol use. But unfortunately, I think that teamed with the work that we do, there's going to have to be a cultural shift too between parents, between students in our school, that will probably have to happen alongside what we do in order to see some of these numbers go down.
And one of the things you actually said was the work hard, play hard. The evidence is in the data as well. The stress level of students in Medfield is higher than the surrounding area as well. So students are feeling the stress, and this could be a release of that stress is in this behavior.
Yeah, it doesn't ask in the survey why they drink, if they drink, but certainly it wouldn't be unexpected for that to be the case.
Anecdotally, I think that that's what I hear a lot of the time is our kids are stressed, and that is kind of their go-to mechanism for releasing the stress. They haven't really had the chance to explore various other coping strategies. They don't have the time in their day. And so I think a lot of times they hear stories or they see other people who are drinking to excess and then reporting that it's helping their stress, even though, you know, we know that's not actually the case.
Right, not long term. In the moment, perhaps, but right.
And so you're right, that kind of becomes a lot of students' go-to stress relief, and unfortunately, it's becoming more and more common.
You know, and it is out in culture a lot. Is you see a lot of times, like in movies or even in your own home, like, I know I come home sometimes and I'll grab a beer at the end of the day and be like, man, that was a tough one. Like, let me grab a drink, you know, and but that message gets heard differently from an adult who knows I'm going to have one drink after work or like one drink on a Friday afternoon versus high schoolers who say, oh, my reaction to stress is to drink.
That's right. Modeling is really key for parents.
Right.
Modeling,
Absolutely. And you know, it's funny, I was laughing about this one the other day, was every time you watch like an old Western or like a guy who's like this rough, rugged guy and something happens to him, like what's he do? He grabs a bottle of whiskey and he pounds it.
Right.
And it's like, that's impossible. You can't do that, you know?
Right.
But it's that media is out there, and it's like, that's the image that's constantly seen all the time.
Right. It's reinforced. Sure.
Yeah.
Well, we do have this, you know, just to segue from what Russ was talking about. So we do need to change the culture in the community if we expect our kids to be healthier. And we're in position for that now, because this data over years has led to Medfield Cares About Prevention being able to, thanks to a grant from the Medfield Foundation, we were able to hire someone to help us write a drug-free communities grant, which is a federal grant. and we now have funds to hire a community substance use prevention specialist. So I know you know about that as you sit on the MCPE, the Medfield Cares About Prevention Committee as well. So I don't know if you wanted to, let people know that like this person is going to be hired soon, and this is going to be a way that we can shift the culture among adults in the community.
Yeah, there's I'm on the Medfield Coalition for Suicide Prevention, MCAP, and I'm also on the Medfield Youth Outreach as well. And so just as the media committee member, and so as we talk about this, Medfield Youth Outreach is hiring a new director. When they hire a new director, they'll interview for the prevention specialist as well. So those are all triggering in a row.
Right.
But we talked about this before we sat down today. There are some great groups with some excellent people who are looking to combat this problem. And I think that when this came out, I know I felt you felt invigorated, like, okay, we have the data, we have the information, like, let's go get after it now, for sure.
No, that's great. And, we have such terrific kids and great families in town, and I think that people just need more education. Kids get health education, and they hear it in the health classroom, but they need to see it modeled in the community, healthy behaviors as well. And I think the more that the whole community can buy into, we want to be a healthier community in so many ways. We want more access to walking. We want, more access for recreation, less access to alcohol,
So one of the things too is going back to the data, vaping was one of the things that came up. It was not surprising, I think, for people to hear that vaping had risen a lot, because I think that that's in the community. A lot of people are hearing about vaping. Denise Garlick gave her Medfield Town report, and that was a big issue that she talked about as well, was vaping. But it had risen more in 4 years than any other topic had risen in the 12 years you have done this. Was that surprising to you, was how much it spiked?
To me, no. I think in conversations it was everywhere, and not even in conversations. A couple of years ago, you'd walk down the street and you couldn't go more than 10 feet without seeing somebody vaping or seeing an ad for a vape or something like that. So that data point didn't surprise me. What I think is interesting, though, and this is, again, purely anecdotal, there's zero data to back this up yet because we haven't really had enough time to gather the data. But I think that number, I wouldn't be surprised if it really begins to dip in this upcoming survey's data, which to me just goes to show the power of education. I think when this was collected 2 years ago, nobody really knew anything about vaping. It was marketed as being a healthy alternative to smoking, and our students knew that smoking was bad, but if this is healthy and it's just water vapor, and so there wasn't really much of a barrier for why they would want to, why they wouldn't want to vape. But between Governor Becker's ban on vaping products, between some of the information that has now gone out there, the unfortunate deaths of a lot of people that have stemmed directly from vaping, I see and I hear a lot less about vaping right now, which I think just goes to show if we're having these conversations, if we're getting this information out there, our kids are good and they are smart and our families are smart and they're capable of really curbing some of the more negative behavior that we know to exist here.
No, absolutely, I agree. In addition to the Medfield Cares About Prevention and the Suicide Prevention Coalition that we both sit on, I also help co-chair the Health Advisory Committee for the school district, and we have some students on that, some juniors and seniors, and we talked about this at our last meeting last month, and they said that students report that now it's safe to go into the bathrooms without fear of kids being in there, juuling, and that it's their friends are less likely to be seen, with product on them. They're not, they're just not seeing it as much. So kids are seeing a difference, again, anecdotally, without collecting any actual data.
Which that's a big thing too, is whether or not you're going to see the data sway. You're at least seeing the culture sway, where kids are like, I'm not going to do this as openly, because it's seen as something that's not good for you. Kids are identifying it as, hey, you shouldn't be doing that, and so they are taking it out of the schools. And so hopefully you are seeing the dip there. That's awesome that the information's getting out to them.
Right. We still have a ways to go, but I agree that it's not as prevalent
Yeah.
as it was at the peak.
You have the breakdown of the use by grade, and so this is, obviously, I think expectingly people would know that it goes up as you get older.
Right.
It was something though I looked at was like current alcohol use in the past 30 days, and the current EVP was, is that vaping?
Electronic vapor
Yeah.
products.
So EVP as well. Almost half of seniors are using either alcohol or a vape at that time. Is that how I'm reading that?
So there were two questions. Have you ever in your lifetime drank alcohol other than for religious purposes? And then a separate question would be, have you in the last 30 days used alcohol? So those are the current users I referred to earlier. So that's what this slide is for. 45% of seniors said that in the last 30 days I've had at least a drink of alcohol that was not for religious purposes.
And so
So
now
again, that's less than half. I'm sorry, I was on the wrong slide. Alcohol was 56%.
alcohol is 56, vaping's 45.
Right.
Yeah.
So nearly 50% of kids are not current users of alcohol, and I think it's really important that we remember that, that not just the students who are, but almost half the students are not current alcohol users in this. Now this is last year's senior class, because this
Right.
data was collected last school year. So any of the grades that you see on the slide would be the grade that students were in last year.
That is true too, is to think about this data is, yes, you can look at it and say 56%, but also there's 44%
Right.
that's looking at this and saying, we don't drink.
Yep.
Right.
And so I think that that's actually pretty shocking is people think that all high schoolers drink alcohol or that all high schoolers are involved in this. And I think that idea supports kids drinking more, is thinking that
Perception,
like,
right?
yeah, the perception is reality, right?
Right.
Is all of us are doing it, so it's okay for me to do it. But to know that no, half of your peers are not doing this is maybe more supportive of saying like,
Right.
you don't have to drink, half of us don't. you
Right,
know?
that's right.
Absolutely.
Absolutely. And I think, when students think about their own group of friends, either everyone drinks because all their friends do, or they may be able to say, like, most of my friends don't drink because their set group of friends is part of the 44%.
Now, one of the things that I hear all the time and is that there's nothing to do in Medfield, and therefore
Deadfield.
it's Deadfield, and therefore the kids drink. Now, I don't know. I didn't ask you guys this prior, but do you feel like that's an appropriate excuse? Do you feel like that's something that someone could say and be like, "This is why it's happening"?
I would say, there's not a whole lot more going on in Millis or some of these other towns, and their numbers are significantly lower than us. I think it's more of an active choice of our students to drink and having the culture shape that as being an appropriate behavior, as opposed to, well, there's nothing else to do. I think honestly it's as easy to drive to Legacy Place or to the movies, or to just hang out with your friends without alcohol being an element of your experience. And I think it has probably less to do with other fun things going on in the area.
Right.
As we look at now the next graph, the actual use comparatively to the rest of the Metro West and the rest of Massachusetts and then the United States as well. So cigarettes is almost completely gone from Medfield.
Well, that will be interesting to see next time, because there are students, and this came out in our conversation at the health advisory meeting, and I've had other conversations with students as well, that there are students who never smoked cigarettes but started vaping, and as a result have picked up smoking cigarettes. So it'll be very interesting to see if that starts to increase, because we've historically always been lower than the region, the state, and the country. A
It's
reverse
almost
effect.
the opposite effect is vaping started cigarettes where people thought it was going to go the opposite way.
Right.
That's very
Well,
interesting.
people, vaping products were marketed to help people quit smoking cigarettes, but most of the people that use the product never had smoked cigarettes.
Right.
So I think,
It's just becoming an alternative now.
yes,
It's
yes.
it's again to that
the
point
barrier
of the
was
safe
broken,
alternative,
right? It may have been an entry point
Yeah,
for
absolutely.
students to try something a little bit riskier.
Now, the Metro West is 26 communities, if I have that number correctly. 26 communities, and so this graph shows the comparison of Medfield to the rest, and we don't have to go through each one. It's pretty evident what it's showing is Medfield is using higher than the communities around it. And so we don't necessarily, like we pointed out, is the community is doing something. There are groups of people who
Yes.
are making a strong effort to help, turn the tide here as we talk about it. But for parents to know that we are the highest community using these substances. And so maybe there should be a discussion at home, maybe there should be a conversation.
Yes.
What are some of the things that parents could be telling their kids to help turn this tide?
Well, first of all, parents could, they want to first check themselves and make sure that they're modeling appropriate alcohol use and not using alcohol in excess themselves. They want to talk with their kids about the dangers of alcohol use and the dangers to the developing brain, the dangers around addiction. The younger you are, when you first initiate the use of alcohol, the more likely you are to develop addiction to that. Any parents who have any type of addiction in their families, whether it's alcohol or any other substance, they should be sharing that information with their kids because they are biologically at higher risk. Any mental health issues that the parents have in their families, they should be sharing that with their kids because that puts them at higher risk for substance use. They should let their kids know that they don't approve of alcohol use by minors and that there will be, institute some firm policies in their home because parent disapproval is one of the most significant reasons why kids say they don't drink. Kids who don't drink don't use other drugs. It's because they don't want to disappoint their parents. And the other thing that showed up on the survey that kids said for reasons why they don't drink or use other drugs is they didn't want to disappoint their coaches.
And that's such a powerful thing is we have the evidence that kids who don't drink don't because they don't want to disappoint the adults that are showing a good example. But if those adults aren't saying it, then they're not setting that precedent. And so maybe just the fact of saying like, hey, you shouldn't be drinking could be a powerful enough statement that kids will avoid it.
Right.
And I think too, so to me, to your point earlier, that's in part where the data comes in. You can pinpoint the fact that our community has a much higher rate, and so therefore it's a much bigger problem here than it is in other places. But to flip the data around, there's a great group of kids who don't want to drink and are actively not seeking that out. In addition to that too, I think given how prevalent the numbers are, there's a real high chance that high school students especially are going to be surrounded by drinking or have the opportunity to partake in drinking at some point over their 4 years here. It might be worth a conversation with your kids to make a plan for when that happens. How do you say no? Or I've known parents who kind of have a code word with their kids that if the kid texts saying, my knee's acting up or something like that, no questions asked, the parents come pick them up and they can kind of be subtle about it. But I think to both of your points, just having those conversations as a starting point and figuring out what's comfortable between you and your kid is a great place to start and a great way to go.
And I think parents talking to one another, often kids will hang out with a group of friends and the parents, because they've grown up, either on the sidelines together, they become friendly too. And communicating with one another about, what you're allowing in your home and just being open and honest about it. I think, we both love our kids that we work with and such a great community. We both are really happy working here. So we don't want to see any harm come to the kids. And that's what this is really all about, is helping them to live really full, their best lives.
And as we continue, we'll move into now the second half of this survey was, I don't know if it was the second half, but the mental health portion of it, equally as important, is between these two. I think the substance abuse, I think, gets a lot of attention. I think people talk about it. They kind of know it's out there. You see it. But the mental health portion, people do not like talking about mental health, and it's such an important and prevalent thing in not only just this community, but around the country, that we should be talking about mental health. So tell me, first of all, what were some of the things that you were looking for in the data, that mental health specifically, what were some of the things that you guys had highlighted that you wanted to see?
I believe there's one slide in particular that I tend to gravitate towards that pinpoints the levels of stress that our students are feeling, the levels of depressive symptoms, anxiety, current self-harm, and suicidality. So that, I think, really encapsulates mental health as kind of a blanket. And through that, you can kind of tease out various trends and sort of comorbidities with some of the other pieces. But to me, that's always the most important data. and then all of the questions that obviously surround those things as well.
The interesting one was I felt like the feeling lonely. I didn't ever consider that as something, that they would ask. I guess when you talked about mental health, I didn't think like feeling lonely, but once I heard you talk about it in the school committee meeting, once you presented it, it made so much sense to me that these are the students that felt like we're not involved, we're not a part of this group, and that's such a strong statement that I think that you made during the meeting.
It's something that we hadn't really noticed in past surveys that really stood out to us because there were other things, different things stick out at different times. I think that having a big group of people that contributed to what sticks out, you got so many different perspectives, and I was so glad that came to the surface, because sometimes we think that kids, because we have such a high engagement level of kids in sports and music, drama, we think that everybody's involved. But there's this pocket of kids that just aren't. And every single administrator in that room and every single guidance counselor, and we were all drawn to that. So this is something that we're really taking a look at to make sure that kids are connected, that all students have a place to feel connected.
But I think it's interesting to point out because, like you said, we have a ton of engagement. The numbers, however, don't quite match up. So it's not like the 10% of kids who are not going to sports or going to clubs after school. It's not them who are the lonely ones.
Right.
It's more than that. And so I think there's a lot of kids who are engaged. There's a lot of kids that on paper have a lot of social connections or might be talking in the halls with other kids, but then go home and don't really know how to engage past the confines of their schedule. And I think saw a study recently that this generation is the loneliest generation in human history to this point, which is kind of counterintuitive given how much connection there is on social media and how much opportunity for face-to-face connection there may be. But to me, I think there's a real breakdown in kids' ability to not feel lonely and to reach out and formulate plans and develop deep relationships because of maybe a lack of skill or even a lack of time. Honestly, it's hard to really carve out enough time to hang out with friends in the way that maybe we once did when we were growing up.
They're so scheduled. They're very, very scheduled and organized activities. And for us, it was more, you'd come home from school and you played. You changed out of your school clothes into your play clothes. You went out and played and came back at dinner time. And then after dinner, you did some homework and that was it. But you didn't spend every waking hour engaged in something organized by adults.
It's so interesting when we went through this, when I was going through it, was one of the things that I felt was really prevalent or stood out to me was the students who don't have dinner with their family. And I remember growing up, it was always families that eat together, stick together. It was like obvious. It was always reinforced that like you should sit down for dinner with your family. And the fact that isn't happening as much, or that's a stress relief for kids to be able to sit down, that was something that stood out to me. And I think if you gave this survey to adults, you would probably see that the stress level in adults is really high too, because they're not having time to come home. It's not like we have like these awful parents running around who are like, I'm not going to eat with my kid tonight.
That's right. They're running them to practice. They're running them to games. They're crossing paths. You take these 3 kids, I'll take these 2 kids, and doing the best they can to.
When I read that, I sat down and I said, man, we should really stop and slow down for a second. We should sit down and really talk to each other and have those dinners, those meals, and how important it is to be a family and to all sit down. So that was one of the things that like stood out to me so much when I saw this afterwards too.
Yeah, I think that kids don't get enough of that face-to-face time with adults as models. They're with their teachers.
Yeah.
And they get FaceTime with their teachers, but I know that even for my students now, I have to say to them, we have a couple minutes right now. I'd like you to sit and have a face-to-face conversation with the people sitting across from you. Because if you give them 5 minutes in the class, they'll instinctively take out a device. Like that is how they want to spend their time. And I probably would be apt to do the same thing, But you have to almost direct and call out face-to-face time.
Which is interesting. When I was in high school, I remember if a teacher was ever like, hey, work on something while everyone starts talking and it explodes in conversation.
Right.
But that doesn't happen as
No.
much now as when I was in high school, it was a flip phone and a text, and it was like, that wasn't that interesting. But these kids have these devices that are
Right.
just, everything is in that. So I can definitely see the difference there for sure. But what an interesting thing to tell the students, like, have a conversation with each other. How do they react to that normally? Is that?
There's a pause. Oh, well, at the middle school. I don't know about the high school, but at the middle school, there's like this pause. They look at each other, and somebody tries to come up with something to say. They're like this. They're just, so, is anybody excited about vacation? And they'll just come up with some conversation starter, but it's not natural. They have to work at it.
That's interesting.
Yeah.
I talk to the students here whenever we're working with kids. I coach back at my house. We coach kindergarten and 8th grade. So I have a big, wide range of kids. Yeah. And it is sometimes, it's work to get them to feel comfortable talking to you, to get them to feel comfortable talking to each other. I mean, I coach wrestling, so it's literally kids are bumping up against each other and wrestling. But if they could choose to be on the opposite sides of the rooms, I think that they would and be like, I would much rather not do this right now.
Right.
But yeah, I see that all the time. So one of the things in this is the behaviors leading to lower stress. And we talked about already eating with your parents, but do you want to go through some of these things that parents or kids could be aware of that they can lower their own stress?
Absolutely. So the way we got this information on the slide is that students answered questions about each one of these. Then we also looked at the amount of stress that each student said. So the survey is completely anonymous. We don't have the names of any students. But at EDC, they can give us some additional data that doesn't come through on the full report. And they can look at all the students who said that they have a supportive parent or adult outside of school. And on all of those student surveys, they can see what those students said about the stress level. And those students reported lower stress than the students who did not have a supportive parent or adult. Those who said they ate dinner with their parents 5 days a week or more also reported lower stress overall than those who did not have dinner 5 days a week. So as you look at that slide, these are co-occurring. Students, we can't say that by spending less than 3 hours online, you're automatically going to have lower stress. It doesn't cause lower stress or doesn't reduce stress by being online less, but the pattern exists that those who were online less had less stress. Those who got more sleep had less stress. Those who had dinner with their parents 5 days a week had less stress. So if you want less stress, try these 5 things.
With that said, though, I think those are relatively obvious and easy things that we all know. And I think that then speaks to just how feasible are some of these things for our kids and our families. I think the vast majority of our curriculum, you kind of have to be online in order to really engage to the level that's expected of you. And so doing that and getting 8 hours of sleep a night, eating with your parents, having that face-to-face time, it takes active maintenance from, I think, all areas of the kid's life.
It does.
And oftentimes it falls short because our kids, going back, the work hard, play hard mentality exists. And so they really do want to do everything and push themselves to their limits and take advantage of all the opportunities that they have available to them, which then means that they are not getting nearly enough sleep. They're online working their tails off. They're not spending time with their parents. And so then we do see increases in mental health problems afterwards.
Now, one of the things we should know for sure is that parents are being supportive of their kids.
Yes.
One of the slides that you have is the adult support, and you made the point that 90% say that they have an adult in their life that supports them, which I think is an incredible statistic. And I'll be honest, when I go out into the community, I'm not from Medfield, so I have this almost like third eye, this perspective, is there is so much support in the community. Parents care so much about their kids.
Absolutely.
They're in all these organizations that come up.
We see them in all our meetings.
I know,
right?
we
Yes.
see them all the time in the meetings. The Medfield, the MCAP, they have, I think it's 40-something other adults that are in the email chain and whatnot. These are incredible numbers for adults who are trying to support their kids. It's a pretty incredible statement.
Yeah, it is. And as long as I've been in Medfield, it's been that type of community. So that's been consistent over a long period of time.
As we go through this, it's important for us to talk about some of the things that we that you saw specifically. But Susan, you said in the school committee meeting that sleep was a really interesting topic for you. You like to talk about sleep.
Well,
what about it? What is it that drives you towards that?
Well, I know how I feel on days when I've had enough sleep and how I feel comparatively on days when I haven't had enough sleep. So I'm less productive, I'm less clear-minded, I don't have the same energy, I don't have the same patience, I'm not as creative, and just that whole energy level, you know, how we feel when we're tired is just not the same as we feel when we're rested. And so it affects every single part of your life. My workouts aren't as good, you know. So for students who are supposed to be learning and growing and developing, it affects absolutely every phase of their life. They're not going to learn as well. They're not going to develop interpersonal relationship or communication skills as well. They're going to be grouchier with their parents when they're trying to get out the door. They're going to be running late, and it just leads to conflict in relationships. It leads to so many factors. You know, as it says on there, more driving accidents happen when people are sleepy. More anxiety, depression symptoms are more apparent. So growth happens for teenagers while they're sleeping. Our bodies repair ourselves, you know, at night while we're asleep. So having enough sleep is, you know, I can't think of anything more important than the need for sufficient sleep. So, you know, I feel like it's, I heard in the talk the other night, there was a parent talk where woman came in and spoke on the importance of sleep, and she talked about sleep being the third leg kind of the stool, equal to nutrition and exercise in terms of good health. But honestly, as much as I'm a huge advocate for good nutrition and good health and exercise, if I had to rank them, sleep would come first, just because it's that essential.
Now, one of the other things on this was violence and bullying. Specifically, I think when people think of violence, you kind of get the general idea, but bullying specifically, I know that cyberbullying and bullying were separated on it. But what is bullying? What are we talking about when we say that? Bullying
was defined on the survey. I don't have the exact words in my mind right now, but it's something to the effect of repeated teasing, taunting, pushing, threatening behaviors by one or more people. So it's that. And before they ask any questions about bullying, it'll say, like, bullying is defined as this repeated behavior, and then there's a series of questions about it.
What's interesting is that I felt like that's very specific.
Yes.
And so this isn't, we're not talking like I'm teasing or you know, someone says a joke to me and I felt bad about the joke being said. This is a consistent, you know, statement or a consistent behavior that is happening over time. And as we look at this, 24% of Blake Middle School, 26% of Blake students were verbally harassed. Were these things that you guys were surprised by as you saw these things?
I'm not really surprised by the middle school bullying percentage. I was more surprised by the high school. The high school reported higher bullying than in the past, and usually that's a behavior that you see peaking at the middle school age and then going down. The verbal harassment was a separate set of questions from bullying. It's concerning. But the only reason I'm not surprised by it is because I've been studying this data for so many years. But if I were looking at it for the first time, 1 in 4 kids saying that they've been bullied, which is repeated over time. Considering we look at our kids and we feel like we have such great kids, you know. So they're very subtle with their bullying. It's not typically right out in plain sight where adults can recognize it. It's happening, you know, in more subtle ways.
What can we do with this data? What can we as community members, as residents, as parents, what can we do with this data? What should we be thinking about as we go forward?
So personally, I think going back to the actual definition of bullying, it's very specific, and after I read that, it kind of surprised me, and I think I wouldn't be surprised if a lot of students read that and something dawned on them that they then realized that they had been bullied for X amount of time or in various experiences. Identifying what bullying is a huge piece of the puzzle to me. And I think there is a little more nuance in it as well, because is two people going back and forth in a joking manner, one person can absolutely perceive that as bullying. And what do you do if that is the way that you feel? And if you feel that you're being targeted, you know, what are your options? So I think identifying what bullying is and breaking that down to a student-centered lens, and then highlighting options and areas of support where they can go or how they can access those people and those places after the fact is important too.
Right. There's a lot of efforts going on at the middle school, have always been going on at the middle school all through the years, to help students recognize what bullying is and what's, behaviors are expected of students. There are also formal ways for students to report bullying in both schools, and there are very, very few reports of bullying. So we have this huge gap between the number of students who report bullying and the number of students who say on the survey anonymously that and this is a 12-month period of time, so in the last 12 months, have you been bullied? So one of the questions asks, what are the barriers, for you who've been bullied to not report? Like, why are you not reporting this if you've been bullied? And, they don't have a perception that if they report it, that it will get better. They more fear that it would get worse. So that's a little bit of a problem. But, again, this is another thing that administrators are talking about, that we're always talking about ways that we can improve the students feeling safe at school.
And one of the things you mentioned was this survey in general was something that you sought out after. Just knowing that administrators in Medfield are aware of these things, they are working on them constantly thinking about how to solve these problems. I don't think it's an excuse, but I don't think anyone would be surprised that middle school has bullying. I think that that's kind of the time that kids are trying to figure themselves out.
Right.
And I think that we all went through middle school and know what that was like.
And we all came out the other side.
Yes, exactly.
Right.
It's not an excuse, but obviously it's something that, we are aware of. But yeah, definitely the high school having a little uptick is, conversation starters and things that parents could be talking about, people can be made aware of.
And teachers, being aware of just knowing that it's happening in their school so that they can be eyes open for it, to be aware and be sure to intervene.
The other one was sexual behaviors. One of the things that you kind of summed up for us was fewer high school students, and this was also just high school. You didn't ask middle school students this
No
question.
sexual behaviors on the middle school.
So high school students had fewer sexual behaviors in Medfield than the surrounding areas, but were higher when alcohol or substances were involved. Was that the
right? There's a question that asks, the last time that that you had sexual intercourse, were you under the influence of alcohol or marijuana or something like that? Yeah. And as we were talking earlier, yes, we were higher in that than anybody else.
But we're also higher in the use of those substances.
For that reason.
And so
for that very reason.
Right.
Yes.
And so to say like, oh, our kids are drinking and then going off and doing, some sort of sexual behavior afterwards, that might not be the case. They are drinking more, they're using substances more in general. So when it does happen, the chances of it being. And,
we have a comprehensive sexuality education curricula in our school system, and we're really happy that our sexual behavior is lower. We have kids are reporting they have fewer partners than people in the region and the state and the rest of the country. So in general, they're reporting good, healthy choices. But when someone's under the influence, they're not going to make the same healthy choices that they would make if they're not. So that's our concern.
And again, that almost looks back as the sexual behaviors. It seems like we're trending in a good, or at least a healthier.
It's been consistently
a
healthier
trend
than others.
there.
Yes.
And it almost points back to when there is a problem with the sexual behavior section, it's the substance use that we're concerned about. So that's something to definitely look at. The sexting was something that I know people are pretty aware of, but that's pretty low here in Medfield as well, which was a good thing to see. Do you see that's not?
It's not that I don't think it's low.
Okay.
I think that it's not our biggest problem.
Okay. That's a better way of putting it, for sure. For sure.
It's concerning. But, talking with students about it, students don't report that as something that they consider a risky behavior. So that feels like a safe behavior. So just pointing out, the permanence the potential for permanence of a sext being sent.
And one of the things that is actually one of the other statistics that I thought was interesting was when kids do receive a sext, it's more than likely that it's from someone not who sent the original one. So
It's being
being passed around,
Right.
which is that's maybe the most alarming
Right.
part is
Right.
when the decision is made that I'm going to send out my body or I'm going to send out this message. That person is then making the decision, whoever's receiving it, to send it out on their own, which is, that's the alarming message there for sure.
Right. There's two people right there making a choice that they're thinking isn't super risky, but really is making someone very vulnerable.
Yeah.
Yeah.
And it's interesting because in the internet age where we kind of live in this idea that everything is kind of forever and that it gets passed around and it's so easy for things to move, that kids might not think that that's a problem, that is something that happens.
Right. It's the world they've grown up in, and it's their only world they've ever known.
Yeah.
But I think that the numbers are lower than maybe they had been in the past, or maybe at least lower than I would have expected, and kids aren't determining that as so much of a problem because of what I think you said. Sexting has been around for, I don't know, the past decade plus, and so now that we are 10, 15 years removed from when it was probably like vaping, once people had like unfettered access to these things, and I'm sure sexting was much higher then, time has gone on, and so information is now more pervasive about the permanency and the actual dangers that come with some of this behavior. So I feel like I'm beating a dead horse, but over and over and over again, I think this data points out the importance of information and the importance of conversations like this, because we know as time goes on, it actually affects more positive change within our kids.
One of the things I want to ask is there a way, because we're going to skip ahead here too, because I want to talk about the positive things that are going on in town, because you have a fantastic list of all the things each of the schools are doing, the action steps that are going on, because I think that some of these ideas are just fantastic. But is there a way, if a parent or someone watching is interested in seeing this data or seeing the presentation, obviously you can go back to the school committee meeting, but seeing this data, is there a place that they can go?
Yeah, on the school website, the superintendent has posted the entire report as well as this presentation, so they could access the data there on medfield.net under something.
Yeah.
Call the superintendent's office and they can direct you, but if you search, you can search for it, actually, the 2018 Metro West Adolescent Health Survey data. Yeah.
Now let's talk about some of these awesome things that these schools are doing. So like Memorial School, some of the things that they're doing. Can you tell us some of the things that these schools have in place that are making a positive motion for these kids?
Absolutely. I mean, I think over time, we're just so blessed to have such a great school district, and it's been a very high-performing district for many, many years. Some of these are new programs, but they've replaced other programs that were good at the time that they were in place and then needed to be updated and replaced. So this is just like the new things that are going on. Lunch bunches is a really big deal. Adults facilitate students in small groups having lunch together maybe in the guidance office or a special place where students can work on their interpersonal communication skills and engagement. And some curricula at the Memorial School is Open Circle, Social Thinking, and Choose to Be Nice. So they have 3 social emotional learning curricula, all designed to help students collaborate and manage themselves well, and manage their emotions and their interactions with one another. So it's really a tremendous effort going on, at the Memorial School along, healthy behaviors.
It'd be interesting to see a trend is if the conversations, if kids are more comfortable talking to each other later on with the circle classes going on, that kids are starting to understand that they can talk to each other, that can happen. The Wheelock School, you pointed out the Peace Builder Pledge is something that people should...
Have you seen that?
So I haven't seen it yet, but I've made a note. I have to go watch it.
Yes, I will send it to you if you haven't seen it online. So students read the morning announcements and they're videotaped, and it's on YouTube, although it may be a private YouTube channel. But every day, in addition to the Pledge of Allegiance, they also recite the Wheelock Peace Builder Pledge, and it's adorable. And the kids are reciting it, and they're promising to be kind to one another, and it's great. They're making phone calls to parents for kids with good behavior. They have third graders have special jobs that they're assigned to help build responsibility.
That's
like
one of
that.
the best things I think I saw was the good news phone calls.
Yeah.
I think so often if you're a parent and you see the schools calling, you're like, oh, what did my kid do now? But to have good news phone calls, that's such an awesome idea to spread like good news and good things that your kids are doing in town. Is that something that you think is a powerful message for parents?
Oh, absolutely. It's so funny. I'm sure we'll get into this, but we actually brought this up at our social emotional task force, of which we're both members of. I'm part of the student wellness team, and we literally discussed this last meeting
Monday.
as something that we think would be such an amazing benefit for all of our students district-wide. Like you said, far too often parents only get communication from the schools when there's something wrong or there's something missing or something needs to be discussed immediately.
Right. When I call a parent from school, I always say, hi, it's Susan Cowell from the high school. I just want to let you know there's nothing wrong. Like that's the first thing because they're going to expect it to be,
Exactly.
Yeah, absolutely. I had a parent who had to talk to me and they're like, hey, I don't have a problem with you, but I just wanted to talk to you real quick. And I'm like, okay, like you didn't have to start it. Like, I know that people talk.
You don't want people to worry.
Yeah,
that
it's
there's
amazing,
wrong.
but it is that trigger that if a school person is calling that it's a problem. But this is such an awesome, an awesome
Dale
change.
Street also does positive referrals where any teacher can refer students. It's weekly. I think whenever it happens. It's not that there's one every week. It could happen weekly. It could happen daily. It's anytime. And those students have a certificate. They're photographed. They're in the principal's newsletter. That goes out. Parents are notified. And at Blake, they have the postcards that teachers can send home, and the principal sends home. Blake postcards, all positive referrals. So it's really great.
Yeah.
Did I interrupt you?
No.
I think I did.
But the Dale Street School's doing a lot of great things, and then obviously as we look at like the middle school and the high school doing some awesome things as well. Can you tell me some of the things that are going on between 6th to 8th grade and high school? What are some of the programs there?
I can sort of speak to my involvement in a handful of things. One of the sort of protected groups that we know struggle throughout middle school, throughout high school, are our LGBTQ plus students. I think that probably goes as no surprise that they have significantly higher degrees of depression rates, anxiety rates, self-harm, suicidality, and that's not just for our population, that's just kind of across the United States. And so we were able to meet with a woman a couple years ago who ended up giving grade-wide discussions with each, I think pretty much it was an optional thing, but the vast majority of our student body at Blake were able to listen and hear her story, as well as get some information about various groups and what these terms mean. And from that, we were actually able to formulate our own GSA at the middle school, which started out very small. We had a couple shy kids who were brave enough to sort of cross the picket line and join this group either as allies or as members of the community. And from that, it has boomed. It is a really, really amazing group of kids from all grades and all identities and all sort of walks of life who just want to sort of be seen and be welcomed within the Blake community. And I think that's kind of a microcosm of what I feel the culture in Blake always was, but has become even more so. Between a number of different things that the other guidance counselors or Principal Nat Vaughn has embarked on, there's opportunity for so many students now to, I think, feel connected and to sort of explore their identities and feel celebrated for who they are as individuals, whether it be through the affinity group. There's a couple other things that are escaping my mind at the time being. But there's been an impressive push, I think, for social emotional learning and just overall wellness and a celebration of who they are as people at that level, which I think is pretty unique to Blake. In addition to that, so just for me as well, I'll teach lessons regarding anxiety management, resilience building. For the 7th grade following up, we have the Samaritans come in and give a talk about depression, suicidality, what to do if you are feeling this way, what do some of these terms mean, what are some resources that are available to you, and I'll sort of give a supplementary lesson about what to do if a friend is struggling and who to reach out and what that might look like as well. So I think there's kind of always something happening from the Blake level and as well as the high school, which we'll get into in a second. But coming from other districts into Medfield, I've been blown away by the willingness and the availability of some of these things.
Right, we have an advisory program in both schools. At Blake, the advisory meets, they meet every day, but they do advisory activities every Wednesday. At the high school, it's a little less frequent, but those advisory programs are designed for students to build a relationship with an adult who may not be their teacher, may or may not be their actual teacher. And through that program, there's a lot of social emotional learning, inclusion activities. District-wide right now, there's a big push in our district for inclusive education. We're really taking a look at all of our educational materials and making sure that all voices, that when students look in a textbook, that they see themselves reflected there, that it's not, we're trying to broaden our scope from this very, white European view of our nation's history, if you will, right? So there's a lot going on right now along those lines to make all students feel included, or to actually include all students, yeah.
That's awesome. And these are the things that it's a lot of little things that you have to change and make little statements along the way that add up to these big numbers, these big ideas. I think when parents or when students, when community members think of like, man, how are we going to combat this huge problem? I don't think that they think that it's little things that you can do along the way that help improve the morale, the standard, the idea of what's going on and what's healthy decisions. So it's awesome to hear that each school is doing something.
Absolutely.
Whether it be the kids reading the Peace Builders or the Gay Straight Alliance being a big group that's welcoming people, the books in schools. That's awesome. I'll say this: we have gone through a ton of information.
Yes.
I think that this was a fantastic conversation.
Great.
Susan, we talked about wanting to have a good open discussion about this data. I think that we did a great job of that. Is there anything more that you feel is an important message for people to hear? If one last statement of this is the important thing we got out of this?
Well, I think that this survey provides us a lot of really valuable information, but it is just one piece of our view of our students. It's a really helpful piece because we have it over many years, so we can see trends forming and we can see changes, and so we can use it as kind of a barometer to see how we're doing and where we can improve. But I think we have to think about it as that we can all learn from this. So students can learn from this, faculty can learn from this, school administrators, parents, and I think having the community involved in talking about the data is really important. Just getting people to talk about these topics is where change really will happen. Until that happens, I don't think you'll see as much change. So I appreciate you having us on to have a conversation about it, and hopefully people will engage one another in conversations on the sidelines.
Absolutely.
Yeah.
I'd say just more specifically to my line of work and to what the data kind of shows, I think we really need to continue destigmatizing mental health and talking about it and recognizing that nationwide there's a problem, but I think a lot of the mindset just historically in this town is that that can exist, but it's not a Medfield problem. We know that's not true. And I'm thrilled to see that some of these levels are going down. They're still way, way too high. And so having conversations like this, being willing and open to discuss things that are really hard to talk about, I think is going to make a pretty significant change as time goes on. And honestly, it'll end up saving lives at the end of the day. So I don't really know what's more important than that as far as I'm concerned.
Just lastly, if parents who are watching are concerned about behaviors of anyone in their family, themselves, their partners, their children, they should seek help right away. Don't hesitate. Don't think, oh, maybe it's not important. Maybe it's nothing. Maybe it's just a typical teenage behavior. It's really difficult to tell the difference between normal teenage behavior and the behavior of a teenager who's struggling with depression. There are resources available in town, and people should reach out to their physicians, to their doctors, and get support.
And one of the things that we work on is the interface.
Yes.
Absolutely.
Right.
The interface helpline is available. to anyone
Any Medfield resident.
Any Medfield
Mhm.
resident. It's an awesome resource that people should be using, and it sounds like people are using, which is
Yes,
great.
that we
So-
are, yes.
And
It's
that's
fantastic.
that's one of the things I think is important to say is this isn't something that you should be ashamed of or
Right.
afraid to use. People are currently using
Yes.
Interface. It's a helpline that you can call. It's 617-332-3666, extension 1411, and they'll help you through whatever problem it is. And just like you said, if it's you're concerned about someone, if you have some questions to ask, it's a resource that is for Medfield residents that they can use, and it is a terrific resource indeed.
Right, absolutely.
But I want to thank the two of you so much for joining us on Medfield TV. This was fantastic. And anytime you'd like to come back on and talk about the great things that are going on in the schools, you guys are more than welcome
Great.
to.
Well,
So
thank you so much.
for
There's
having
certainly
us.
a lot to share. Thank
Yeah,
you.
absolutely. And thank you for watching. I hope you enjoyed A Discussion With.